To succeed in a word clerk interview at the NHS, it is essential to prepare for the types of questions that may be asked. And one of the first questions often posed is what you enjoy most about working in healthcare. This question allows the interviewer to gain insight into what you enjoy about your job and working in healthcare. So it's crucial to respond with a genuine answer about your favorite part of the job and what keeps you coming back every day. A suitable answer might be, I'm very extroverted and love interacting with others. I enjoy the administrative and support role and like to help others, including patients, family members, and colleagues. I love bringing positivity to the workplace and knowing I can make a difference in the lives of others each day. As a word clerk, I feel like I can play a large part in the patient experience and be an ambassador of the NHS. I love that healthcare is always evolving and changing, and I enjoy learning and growing my skills as there are so many opportunities in this setting. Another question often asked is how you imagine a typical day as a word clerk at the NHS. The interviewer asks this question to see if you've done your research and understand the role and responsibilities. To answer this question, you should read the job description thoroughly and be able to give an overview of the tasks and duties you think you would perform in this role. A possible answer might be, from researching online and reviewing the job description carefully, I've learned that there are several tasks required daily. I imagine that it'll be answering the phones and triaging calls, providing medical updates to patients, family members, or friends, scheduling appointments, maintaining medical records, and working with the staff and GPs throughout the day. I envision this as a support role, so I expect to interact with other team members frequently to keep the word operating smoothly. Effective communication is crucial in this role, and you may be asked how you effectively communicate with staff and patients. Because you are working with patients and other staff each day, you must be able to actively listen, clearly communicate messages via phone, face-to-face, and email, and demonstrate compassion and empathy in your interactions while maintaining a friendly and respectful demeanor. A suitable answer might be, first, I listen. I focus on the words and body language to understand how they feel. When responding, I speak with clarity to help the other person receive and understand what I'm saying. I maintain a respectful and friendly tone in an empathetic and compassionate manner. I also use the right communication medium for the conversation. For example, if I have a concern or issue to discuss with my manager, I choose a face-to-face meeting instead of sending a text or email so that the tone and message are not lost in the text. You may also be asked about how you protect patient information. It is essential to demonstrate your understanding of the importance of protecting patient information and consider ways you ensure patient information is not left in public places or stored inappropriately. A possible answer might be, each day, I work with sensitive information as I have several responsibilities relating to patient records. I keep files with private patient information secure by locking them in my desk drawer if I leave my workstation or by locking my computer when I'm away if I'm using electronic medical records. Anytime I fax information to another office, I use a cover sheet and mark the document confidential to notify the office they need to protect the data they are receiving. When I receive a phone call from a friend or family member of a patient, I confirm they are authorized to receive such information. Finally, you may be asked about a time you had to work with a difficult colleague or patient. Think about a time you had a challenging coworker or patient and describe the situation and how you handled it, and include aspects of communication, interpersonal, and conflict resolution skills. A possible answer might be, one of my coworkers liked to play pranks and would often tell obnoxious or offensive jokes during the workday. These antics upset me and my colleagues and embarrassed them or distracted them from the work they were doing. It negatively impacted the mood and morale of the team and took a toll on the team's productivity. One day I asked the coworker to have lunch with me, and she asked why everyone seemed so upset. I explained that her pranks and jokes often offended or annoyed our coworkers. She genuinely seemed shocked and said it was just her personality to be playful and make the workplace fun. I suggested a few more constructive ways to engage the team and told her she could always suggest a monthly social hour to do a team building exercise. She was receptive to my suggestions, and we saw a change in her behavior as she stopped with the offensive jokes and pranks. I think it's essential to confront a colleague professionally and kindly to give them a chance to realize their impact on others and an opportunity to correct their behavior.